People quite often ask me, how can you know so much supposedly about psychiatry? And I tell them, well, in spite of the fact that I was a combat surgeon in Vietnam, and I've made my life's work being a family physician, I was board eligible in psychiatry. I completed 3 years. I was rated 8th out of 58 in the state of California. So it gives me some credibility when I talk to you folks. Basically, we're talking about anxiety and depression. What does cause anxiety and depression? Generally speaking, that's a very complex subject. I will talk about a simplistic way of looking at anxiety and depression. And anxiety is associated with obsessive compulsive personality disorder and many other disorders. But generally speaking, for the large mass of people who feel anxious during the day, have difficulty falling asleep, get nervous, have palpitations or heart races, there's a inciting factor. The inciting factor may be your family situation, your wife or your husband, your children, your college, your childhood. Whatever the inciting factor is, it's something that is outside the normal human experience that triggers the chronic anxiety. Depression, on the other hand, is a suppression of anxiety and an inversion of our anger that is directed outward that starts to be directed inward. People who are not able to express their feelings outwardly may quite often turn those feelings inward and become depressed. Depression can be from childhood. As we get older, there can be involutional depression from old age. Anxiety can be everyday nervousness, everything from being afraid of crowds, to being afraid of heights, to being afraid to go to work, to being afraid to get up in the morning. So anything that can cause stress in our life can cause anxiety. And of course, there are a lot of pills for all these maladies. As a psychiatrist, we had anti-anxiety pills, we have sleeping pills, we have antidepressant pills. Each of these pills has a side effect. Usually, antidepressant pills do not cause addiction. Sleeping pills may cause addiction, but anti-anxiety pills are notoriously known for causing addiction. Think about it. Xanax, Valium, and Klonopin are addictive. Certain sleeping pills, Ambien or Lunesta, can be addictive. But generally speaking, the offset is everyone needs a good night's sleep to stay healthy. People who get too anxious and nervous need a medication, but it must be carefully monitored. These medications all must be carefully monitored by psychiatrists or family physicians. Now, when we talk about how can we, from a holistic standpoint, holistic medicine means we treat the whole person, not just the eye or the ear or the heart. Holistic means an approach to the human body that helps us deal with stress. When I came back from Vietnam in 1968 after witnessing horrific crimes against humanity, my psychiatrist roommate told me that I was depressed. And I said, wait a minute, I shouldn't be depressed. And I didn't realize I had post-traumatic stress disorder. As my psychiatric roommate pointed out, I was suffering from the depression of witnessing tragedies. So anyone who's driving in an automobile, witnesses a terrible crash, accident, injury, those people can suffer the same amount of post-traumatic stress as a veteran who's in a war. So stress stress and depression quite often are together. Depression can be treated and should be treated, because if it is not treated properly or identified, then a person could become suicidal because of the depression, and that's preventable. There are many excellent antidepressant medications. Anxiety, the best way to look at anxiety holistically, and even depression, is to get into an active exercise program. If you've just broken up with your girlfriend or your wife has left you, you're going to be depressed. The only way to get over it, go out and play golf. Start doing something. Get physically active and stay close to your family and loved ones. If you have a family support system, it takes the pressure off of you to the point that sometimes the depression and anxiety can dissipate. Exercise helps you release certain hormones called endorphins. That exercise then will help you lift your depression. Now, obviously, when you get to be 75 or 80, you can't be as active as when you're younger. But even the elderly, such as myself, can find certain exercises that you can do every day. For me, it's 100 to 150 push-ups every evening. I can do that without injuring the joints of my body. For people who have knee problems and so on, or as they get older, they can actually exercise in bed by doing leg lifts and activities that help get movement and mobility. That helps decrease exercise in the older patient or the elderly. So, treatment of anxiety and depression. Well, we know that eating right is always a good way to start. We know that keeping your weight down through exercise, it gives you a better sense of how your body looks. So you know that you're going to feel better by being physically fit. Many young people turn to remedies such as hormone injections and so on. That is a no-no. These hormone injections, including testosterone, can lead to violent, aggressive behavior and depression. Many sports people who've turned to these extraneous methodologies will suffer the consequences. So you're better off to do it holistically. Exercise, proper diet, see your doctor. Anxiety can be conquered through a good exercise program. Being around friends, exercising with friends, playing golf with friends, working out, playing basketball, for men and women alike, getting out and being with other people exercising is probably one of the best ways to lift depression and conquer anxiety.